University of Oxford. And she is currently serves as the director of the Center for Media and Development Initiative. Now, that is the introduction, and I would like to welcome Ms. Thủy to the floor for the presentation. I will have you with the sharing of the slide. So please go ahead.
Thank you very much, Mr. Van. It's my great pleasure here. It's my honor and also my gratitude to the AMIC conference to allow me to present my work. I would like to present one of my ongoing, paper. I'm doing trying to decipher Vietnam communication practice for COVID-19 in 2020 to mid-2021. It's an analysis of a government public social media channel. Like Mr. Van said, right, we went through 4 waves of COVID-19, and my research, my data by far, indeed, I got the data of the 3 first waves, and the 4th. Oh, sorry, is this audio effect? Can everyone hear me? Anyway, okay. So I would like to continue to present. So I would like to firstly brief you the context, the literature review as the research problems that I'm looking at. You see that why the Vietnam case is interesting in terms of communication in COVID-19 health emergency is just because Vietnam have a very special oh, okay, sorry. Can you hear me now?
Maybe can you speak a little bit louder, please?
Okay, I may move it closer to me.
Yeah.
Hello, is it better?
That's a little bit better. Thank you.
Okay, maybe I speak a bit soft. Anyway, so the context in Vietnam have a long border with China, and it have a underdeveloped healthcare system, but until mid-2021, the mid this year, Vietnam have one of the most effective COVID-19 strategy in the world, according to the World Bank. So by May 10, 2021, Vietnam had only 35 deaths. The number is completely changed now but my data is up to there. So and it have only 2,000 infected cases for the community and 1,400 cases imported. And even in 2020, when almost of the country in the world have a very low GDP growth rate, Vietnam actually have a positive GDP growth rate, and it become one of the 3 countries in Vietnam that okay, it's still. Hello, is this my voice better? Can you hear me better? Anyway, please next slide. So anyway, in terms of Vietnam internet user age, if you see the Google Vietnam Search for Tomorrow report, you will see that Vietnam is one of the fastest growing internet economy in Asia. And there are about 68 million internet users in Vietnam in 2020. And it is forecast to grow to 75.7 million by 2023. So more than 90% of Vietnam internet users connected to the internet primarily through their mobile phones. So also in the rural area, about 77% of Vietnamese people in rural area had internet access, and of which 91% access the internet daily. The Facebook user in Vietnam is in 2020 it's about 65.89 million, and it's a little bit reduced in 2021, but it's still 69 million. So it means that internet is very popular and important in Vietnam, and that's why I go to the next slide about how the Vietnamese government is using social media and internet to reach out to the people on COVID-19 information. So the Vietnamese government Facebook account is called Government Informations. It's operated under the Prime Minister office and it's a major channel for the government to do the public communications. So, an initial look, the followers number of that Facebook channel jumped from 200,000 in December 2019 before the COVID outbreak to 1.7 million in May 2021. So it's within the COVID-19 outbreak, the number jumped very significantly, and it's compatible to a major news source in Vietnam, the number of followers. So the content about COVID-19 in Thông tin Chính phủ, the Facebook account of the government, has been popular to the public. So one of its posts, the washing hand music video, Get COVID, had reached over 1.2 million people in February 2020, and it had gone viral internationally. Okay. So actually the media, it's an international media, they prize the reaction of the Vietnamese government to COVID-19 as prompt, transparent and efficient. So the transparency was said to be the major differences between China and Vietnam in regard of dealing with SARS and COVID-19. Despite similar political system, that actually in the literature review that you can read some research, and the Vietnamese public reaches an unusual, consistent following to the government measure on COVID-19 prevention, such as the social distancing and mask wearing, isolation, contact, and tracing. So COVID-19 is said to make the Vietnamese government to be more popular and gaining more support from the public. However, the Vietnamese government is authoritarian, so there have been speculation that it has been using a coercive measure on its citizens that is not replicable in democratic settings. Yeah, that's the argument that from some democratic settings that they cannot learn the lesson from the Vietnamese government because of different system. Next, please. So I looked through some conceptual and theoretical framework. I looked through the social media theory, and also there is strong assumption of the literature that internet access and social media will improve transparency, accountability, and good governance, but little evidence on how is it achieved. So I hope that my research may be one when we find out one of the evidence in the literature. Next, please. Okay, sorry for the volume. Maybe I speak a bit short. So I also use the tool of government in digital age, the NATO scheme that defines the tool available to the government. If nodality is the ability of the government to reside at the center of an information network, the authority, the legal powers, and the treasure, wealth and spendable resource, and organization, the staff and bureaucracy government have direct control over. To do the to try to explore if there any difference of the technology of the digital age that make the make to the instrument of the government. And I use the lens of communicative governance to describe how the government responds to the emerging health emergency as and its challenges. Next, please. So since it's a work in progress, actually it's in very early stage. So I have some rough research questions here, like is the Vietnamese government transparent or not transparent in terms of information about COVID-19 on social media? And research question 2 is the information on the government Facebook account is reliable, accurate or not? And the research question 3 is the content of the post persuasive, informative, or cohesive. And also research question 4 is what's the interaction of the public to the government COVID-19 communications. Next, please. So I answered the question by quantitatively and qualitatively describe the Vietnamese government use of Facebook as a major channel for the government to public communications. And I obtained a data set from the government Facebook account from June 2019 to May 2021. And also I have in-depth interview with various people related. But in this presentation, I mostly present the data set that I obtained from the government Facebook account. Next, please. So I look for, see it very early stage, right? So I first look for information in the government Facebook account, which is like, when was the first information about COVID-19 appear in the government social media channel, and compare to the, to see how prompt it is, and compare to the COVID-19, events in China, and what's the frequency, of the information about COVID-19, promptitude, is there any information that is untrue and unaccountable, how is the public reacted to the post, what are the main messages, what are the content, informative, persuasive, or coercive, and how COVID-19 information impact the government public communication in Vietnam. Next, please. So I analyzed the data set from 1st January 2020 to the 31st of December 2021. So it's the whole 2020. And I found that they have total 2,452 posts on the Facebook account, the government. And the posts related to COVID-19 is 1,150. So it means that 46.9% of the government posts related to COVID-19. Next, please. So from January to May 2021, the total posts is 1,049, and the posts related to COVID-19 is 767. So it means that 73% of the posts are related to COVID-19. It means that the government Facebook, they increase the content and frequency about COVID-19 in 2021. Next, please. So it's interesting to see what is the first post, right? To see how the government prepare or they reacted to the COVID-19. So the first post related to COVID-19 was at January 13. Is now a request from the Prime Minister's office that don't allow the lung-infected epidemic in China to enter our country. It is to note that the Chinese scientists confirmed human-to-human transmission of the virus is on January 20. So Wuhan locked down it on January 23rd. So it means that the Vietnamese government posted quite early, a few days earlier than the most major reactions in China. And in December 17, 2019, there's one post in the about a document that requested the government agency to be ready to cope with winter-spring epidemic. So it only by December 31st, the Wuhan Municipal Health Commission China reported a cluster case in Wuhan, Hubei. So it's the novel coronavirus eventually identified by WHO on the December 31st. So it means that it looked like the Vietnamese government quite take the virus quite serious, a lot more serious than normal, and they posted the preparation even on December 17, although the call is a winter spring epidemic. Yeah, next please. So the second post on January 23rd is showing a Vice Prime Minister visited to Central Hospital to check the readiness for a coronavirus epidemic. And he checked even the special equipment, the ICU. So only on December 31st, like I said, the coronavirus is eventually identified by WHO. So it looked like the Vietnamese government, like I said, they prepare and they communicate to the public about the danger of a pandemic quite early. Thank you, and seriously. Next, please. So what is a public interaction with the government social media channel? You can see here it increased the lifetime total likes and follows, the number of the channel, of the government social media channel increased a lot. You see, I got the number from, started from June 2019, and it's around 200,000, and it flat, So there's not much follower increase until 21st January 2020. So from 21st 2020, you will see the sharp increase in the number of people following the government Facebook account here. And by December 2020, it reached out to over 1.2 million followers, so it jumped a lot number. Next, please. And you will see the total life until May 2021 year, it reached out 1.7 million. Yeah. Next, please. So if you see the interaction here, right, it has a new life here, and the percentage is increased a lot. You can see this number here, right? So it's over 1,600% increase in 2020, and in mid 2020, and by in the whole 2020, it increased by 2,600% of the followers. Next, please. It's quite detailed here, but I looked through the promptitude of the informations related to COVID-19, and I find that it quite. I had to look more at that, but it looked like the post of the government have very little delay, between the event and the post itself. It's quite constant, and it means that it's very fast. That normally, there would be a editorial process, or it's quite a long bureaucracy approval that makes the information slow. But I find that initial find that the post is posted quite fast, and almost the same time with the media, the mainstream media. Next, please. So the next question is the content of the post are persuasive, informative, or cohesive? I still haven't found the answer yet. I have still work a lot on the analyze the contents of the post. But I can show that one of the most popular posts is the Gain COVID, is the government PDA music washing hands song PSA, and washing hands song, and it reached about, like I said, 1.2 million reached in Vietnam, and it went viral internationally. And this the song is obviously quite persuasive. It had no cohesive element as I can find there in the song. So next, please. So the discussion here is that whether the social media is used as a direct route of communications, between government and the people. And I do find that from initial analysis, the Vietnamese government received a significant increase in interaction with the public via COVID-19 informations, on an official social media channel. So the Vietnamese government, there increased interaction with citizens in time of pandemic emergency. So the frequency of the content is high, and the rate of promptitude is high. I have to find more, analyze more the data set on transparency and content message. However, the data set and my paper hopefully will provide an insight and implication about government political communication strategy in time of public health crisis. Okay, next please. So this is my presentation. It's very initial stage, but I hope that it provides some insight, at least on the data on the Vietnamese government, interaction with the public via internet and social media. And I'm looking forward to discuss more with you and hear more contributions, questions so I can able to finalize my paper. Thank you very much for AMIC, and thank you, Dr. Vân, for allowing me to present. Thank you.
Well, thank you very much, Ms. Thuy, for a very interesting presentation with specific data from the research about the government communication about the pandemic on social media. So social media has been very popular in Vietnam, and is one of the fastest way to communicate to the people, much faster than the mainstream media. And you also explain how transparent Vietnam government is in terms of communicating the pandemic to the people and making the message clear, consistent, and persuasive to the people. So we will have time for discussion after the presentation. Now we will come to the second presentation, and that is by myself, about the that's a minute. About the government communication about the pandemic to the people. And this is a research that I has done during the last year, and it has been published in Public Organization Reviews, Q2 journal. And if you're interested at the end, I can send you the link to the article so you can have more details. For me, I have been working at AJC for 17 years, and at the moment I'm the senior lecturer. I have also been guest lecturers to different universities in the world. For example, University of Stockholm, University of Vienna, University of Hamburg. And I hope that my presentation can give you more information about the situation, and also in addition to what Ms. Thuy have said. So now let me share the screen. Okay. Let me show you the screen. Okay, so my presentation is public trust in government during the COVID-19 pandemic, the empirical evidence from Vietnam. And in this presentation, I'm going to talk a little bit about the background so that you understand about the COVID-19 pandemic in Vietnam. And then I talk about the research model so that you understand how I approach the problems and the methodology, findings, and also discussion. So for the background information, I would focus on three main things. First is the 4 ways of infection in Vietnam. Second is the importance of trust during crisis. And then I will present my working definition of public trust in the government, because you know that there's different definition of trust in the government. So Vietnam has gone through 4 different ways of infection, with the first one from 23rd January to April. And you know that the Vietnamese government has successfully contained the first 3 ways of infection. And as Ms. Thuy discussed, it had added a lot of popularities to Vietnamese government because they can protect the life of the people, at the same time maintain the economic growth. But the ongoing fork is much more complicated. It started from 27 April and it has not been ended yet. And the COVID-0 is not an objective anymore. We cannot do that with the first 3 waves. And at the current situation as of the 26th November, that was yesterday, that we have like more than 1 million infections from the beginning till now. And yesterday alone is more than 13,000 infections across the countries, mostly in the south of Vietnam, especially with Ho Chi Minh City and Bình Dương province. And you also see the number of recovery and the death tolls at the moment. So it has been quite serious, especially with the 4th waves of infection. We were very successful with the first 3. And at the moment, the situation in control, but the infection is still very high. And when I study the literatures, I see that trust is very important during crisis, be it economic crisis, social crisis, or health crisis, like this pandemic. Because when people trust the government, they will be more willing to comply with government policies. For example, the ban on gatherings and wearing masks in public places, for example. And you see that with Western or American society, it's much more difficult for the people to follow the government policies because it has to do with human rights and everything. But in Vietnam, the people are much more willing to cooperate with the people. That can explain how successful Vietnam is with containing the pandemic. And when it comes to the definition of trust, there are many different definitions. Some say that trust is a multi-dimensional concept. Some even say, others say trust is an ambiguous concept, which means it's very difficult to define it. But in Vietnam context, trust can be seen as a resource, as a social capital in the pandemic management. And my working definition of public trust is public trust in the government is the people confidence in government communication, policy, and regulation. It is how much people trust the government with regards to their communication, their policy, and regulation during the pandemic. That would be my definition, and based on that, I start the research. And now I will talk a little bit about how I did this research with the research question, the hypothesis, and the model. So my research mainly tried to answer 2 questions. The first question is, do the Vietnamese public trust their government during the COVID-19 pandemic? And if so, how much? Is that a high level of trust or low level of trust? And how is public trust translated into support and compliance with government policy and regulation? Which means if people trust the government, are they more willing to comply, to cooperate with government policy and regulation? So that would be the research question. And this is how I try to, I conduct the research. I will try to explore whether the demographic factors such as the region, the workplace, the gender affect the trust in government, and also the communication would affect the public trust in government. A little bit similar to the research by Ms. Thuy. And then how that public trust in the government translate into public support for government preventive measures such as face mask wearing, social distancing, and also the public support for government financial relief and economic stimulus, public support for government anti-pandemic solution, and also the public compliance with government policy and regulation. That is a research model, and then I try to answer with research. And this is some of the hypotheses. For example, the first one is if people find government communication accessible and trustworthy, they will be more likely to trust the government. And if people trust the government, they will be more likely to support government measure and solution. And the third one is, if people trust the government, they will be more likely to comply with government policy and regulation. So these hypotheses may seem obvious to you, but what I want to do is to prove it with the data. So I conducted an online survey on SurveyMonkey from 27 March to the 19th July, and using the snowball sampling with the help of my friend and colleagues across the country. Finally I got a sample of 1,260 respondents from the north, the middle, and the south of the countries. And these respondents are from public sectors, like government office, National Assembly, and then private sectors, private company, the NGOs, freelancers, workers in the industrial zones, and others. For example, the retired people. Okay, and the youngest person is 16, the oldest is 71, and 128 had some kinds of background disease. So this is a sample in detail. So you can see that I have a quite balanced sample from the north, the middle, and the south, and also from the public sector, private sectors, the third sectors, and different things. So actually, it's very difficult to get this sample. I have to ask my friend across the country to have, so that they can send it to their friends and relatives in order to complete the survey. So it takes a lot of time with this. And this is a little bit similar to what Mystery has said. This is the main source of information for the people about the pandemic. And you see that the television is on top of the list. 76.3% of the respondents using television for information about the pandemic. This can be explained by the fact that during the social distancing, they have to stay at home and then watch TV. And the second main source of information is social media, very close to television. And then everything else, online newspaper, national portals. And you will see that the print newspaper cannot keep up with this. Not many people read the print newspaper for the information about the pandemic, because maybe it is very, very slow. And then the key opinion leaders in social media and in newspaper, also very small number. I remember that Dr. Long Nguyen, the next presenters, he will talk about the roles of KOLs in communicating the pandemic. So we wait for that. And this is the main findings. The first one is about public trust in government during the COVID-19 pandemic, then about the government communication and public trust, and trust in government and support for policy, and trust in government and compliance with the policy. Now we go into details. So you can see that I asked the respondent that how much do you trust the Vietnamese government during the COVID-19 pandemic? With 1 as very low, 2 as low, 3 as neutral, 4 as high, and 5 as very high. So you look at here, you will see that the number of people who have high and very high trust in the government is very, very big compared to the people who don't have low or very low trust in the government. But I have to make it clear that this finding is true with the first 3 ways, because my study was conducted during the first 3 ways. After the first 3 ways has been successfully contained by the government, these findings may not be true for the current 4th waves of infection in Vietnam. If I want to know this, then I have to do it again. And this is the level of trust among people, the respondent from different workplace. So the workplace of the respondent affects how much they trust the government, and people from the public sector trust the government the most, and people from the third sectors, the NGO, trust the government the least. So it seems that the more independent people are from the government, the less they trust the government. So that is a conclusion from my research. And you see that the public sectors and the workers, they have very high trust in the government, but it's a little bit low compared to the third sectors and the private sectors. Okay. And when I do the data analysis in SPSS 26, I can test the hypothesis, and I found that there was a moderate positive correlation between the access to trustworthy communication and trust in the government. So the easier people find to assess and evaluate government communication, the more likely that they trust the government. Also mean if the government communication is accessible and trustworthy, the people will trust the government more. That would be the first hypothesis, and it will confirm with the data. And the second one, I found that there was a moderate positive correlation between trust in government and support for preventive measures. Trust in government and support for financial relief and economic stimulus, and trust in government and support for anti-epidemic solution. Basically, it means that if the more people trust the government, the more they support government measure against the pandemic. And all of these relationships were significant. And the last one, I found that there was a moderate positive relationship between public trust in government and their policy compliance. The more people trust the government, the more willing they are to comply with government policy, even though that policy may affect their personal freedom. For example, the social distancing or the isolations or wearing face mask in public spaces. Okay, so the more people trust the government, the more willing they comply with government policy. And this is my discussion that scientific information is very important to defeat misinformation, disinformation, and malinformation. So during the COVID-19 pandemic, there's also an infodemic. There's a lot of wrong, false information about the pandemic, and those misinformation and disinformation make it even more difficult to control the pandemic because people don't know what and who to believe. And also, the easier people find to approach and evaluate government communication, the more likely that they trust the government. That is why it is very, very important for the government to be transparent, to be public, to be responsible, to be accountable for the information that they give to the people. If they don't give the people trustworthy information, then it is difficult for people to follow. And you also understand that most people don't understand the pandemic. So it is very important that they have to give very understandable, very simple information about the pandemic so that people can understand and follow. And as in the case of Vietnam, the mainstream media is still the official source of information. Social media seems to be an open forum for public debate about the policies. And of course, there's a lot of fake news, there's a lot of information against the government in the social media, making it more difficult to control the pandemic. And one of the things that Vietnam is different from many countries in the world is that all the media organizations in Vietnam are under the leadership of the government. So it is much easier to coordinate the communication about the pandemic in mainstream media compared to, for example, USA. They have private media, and there can be very confusing, contradictory information in the newspaper or in the media in the US. So that is not the case in Vietnam. So maybe this can also explain why Vietnam is more successful with communicating the information and managing the pandemic. And this is my conclusion. The trust in government is the people confident in what the government says and does, or in how the government delivers their promises. So from the beginning of the pandemic, Vietnamese government promised to sacrifice economic growth to protect the life of the people. And the trust in the government has a lot to do with this promise, how serious the government is with fulfilling their promise to the people in protecting their life. And the communication can cause the public trust in government either flourish and diminish, depending on the harmony of the government words and action. If the government is consistent with their strategy, they do what they say and they do it well, then people can trust them more. And in this case, communication can make the public trust in the government increase, or in the opposite direction otherwise. And during the pandemic, in particular, and in crisis in general, it is very important to nurture public trust in the government, not only with accessible and trustworthy communication, but also effective policy implementation. You know that even when the government have very good communication, but they are not doing a good job of pandemic management, then it is very difficult for the people to trust them. So they have to do both. They have to communicate well. They have to manage the pandemic successfully, so that people can trust and follow government policies. So the trust will increase when the government says and does the right thing at the right time. And at the moment, it's a challenge for Vietnamese government to manage the fourth pandemic, because the fourth wave of infection is much more complicated, and the outbreak in the southern cities, including Ho Chi Minh City or Saigon, has been a test to public trust in the government. And you know that it is very difficult to say that we can control the pandemic sooner or later, because at the moment, even the research show very contrasting trends among countries in the world. So this is basically everything that I have done with my research, and my research had been published in the Public Organization Review with the link that I show on the screen. If you want to see the full text, you can go there, or you can Google it. So that will be basically everything that I have to share with you. Thank you very much for the attention. And if you have any question, then we can share at the end of the next speaker. And now we will go to the next speakers. Just a minute. We will go to the next speaker, Dr. Long Nguyen, and he will talk about the roles of the key opinion leaders in Vietnam with communicating the pandemic. This is a very interesting research, and we can see that each of us have a unique look into the communication of the government about the pandemic to the people. Dr. Long Nguyen is currently a senior lecturer at the AMIC International University in Vietnam. He has his master and PhD degree from a university in Australia, and his research interest is in social media engagement, online collective empowerment, internal marketing, health communication, and sustainability. And I just know that he just received Excellent in Learning and Teaching Awards 2021 from IMIT universities. So that congratulations for that. And now, without any further wait, let me welcome Dr. Long Nguyen to the floor for his presentation. So please.
Thanks a lot, Lost, for your introductions, and thanks for your interesting presentations. So I think that's just something that you and Thuy already said. So I just only go through a few of the key points. that to review the transformation of Vietnamese government communication and public affairs. And then we got a case study from the COVID-19 pandemic. And I try to focus on the view of the role of these, we call the earn and share media, or with the role of KOL who have these business or have the communications from the government can be more effective. So I think very back to some of the fundamental review from the government communication. You know, Vietnamese government communication for the last 20 years focused too much on the traditional propaganda approach, and with the merging of the internet and digital media, some change form, but most of the case they still follow the traditional approach to rely on traditional mass media communications, followed by the traditional TV, billboard, banner, and poster. In some of the case, you can see these voice and then the sound system can also be utilized that things. And that's if you can turn on these other few years ago, TVs and other channel also the same content, not very interesting. But situation has been significant improved when the COVID-19 were explained in Vietnam. So in the first case, in the year 2020, in January, you can see the first case of COVID-19 detected. And this starting the 2 waves in the year 2020, and also followed by another 2 waves in the year 2021. And totally we got 4 waves in total. And the communicated and the unpredictable version of the pandemics and the COVID-19 in Vietnam have made a very huge impact to the way how government can maintain this effectiveness of the communication and to enforce people to follow the rule and some common practice for these have the health and safety of everyone in the society. So you can see clearly that the government have done a lot of things together with that. So what the government have done so far, I think that here we go. So give me moments. So I think the old media still play the important role, even though the pandemic have been rocked up and a lot of people have moved to the online platform. But the government still utilize quite well the traditional media. We're using the old media and more on mass media. So then poster, billboard, and even though the car and transportation were used, and you can in Vietnam, people can also hear and see and listen to all the traditional platform, and a lot of local community group involved with the local authority, also contact to the people to remind them about something happened, to come consistently and proactively to send out the message and utilize other things. But together with that, you can see they also have utilized quite well with the emergence development of Internet of Things. So the government now more actively to go into the online platform and utilize their own media channel, like these Ministry of Health website. They set up a lot of social media page. They also utilize the new technology like the mood chat and a lot of system to keep track and also send out the message to the people. So this is the first time I think the government, they try to aggressively move on of communication to the new media. And then so they utilize the current mass media channel they have. And so if you are familiar and update the news, you can see that the government also a number of applications. I think more than is necessary, but again, this is so in the good side that so the government, they try to also align to the digitalizations of the citizens. So now people are familiar with applications and online platform and tools and a lot of things. So government also try to utilize well by collaborate with some of these top tiers technology firms in Vietnam, like BKVs and Big Tales, and also many companies to develop the software. And people utilize quite well the software, and they get an overwhelm of number of software, but now they're under control. But also that's a very good side of the government. Now they try to remove them just traditional way to manage people by rely on of the material and all of things. So everything under one system, and we got now we got tool to change software to use regularly and application used regularly by the citizens to control and keep collecting about what happened with the pandemic. And besides that, this is the first time you can see the government, they very active on social media. So they got their own social media channel, and now they transform social media channel in the hub for them to communicate to the citizens. So I myself and many of my friends and citizens always keep follow on the many social media pages from the governments, from the Ministry of Health, from the Ministry of the educations and other ministry to update about what happened with the pandemic and how relevant to the relevant industry that you involved in. So they also not only with Facebook, but also TikTok is the new channel in Vietnam, and they also got the channel, Facebook, Instagram, TikToks, YouTube's, and a lot of places as well when they utilize well the social media channel to become one of the online touch point to reach out to the citizens. But more importantly, I think it's what to say that the government not only utilize the social media channel, but it could be the third time that the government they try to emphasize and utilize well the role of the key opinion leader, or we call the term KOL or social media influencer, who can help them to deliver and set the message and make the message become more popular among all the people. So the involvement KOL to support and share the government message, particularly when the government run some social media marketing campaign. So then they also have used the role of the KOL to be the role model to play now. So mostly the case they use the macro KOL and try to share the message. So many campaign, for example, the campaign Stay Home and Happy, ở nhà vẫn vui, collaborate with the UNICEF, and also the campaigns from Dance COVID. Again, COVID is also one of the most popular campaigns that the government utilize quite well the role of KOL community. And again, not only located in Vietnam, you can see the campaign has been rocketed up and been shared by many international media channels. So with the again COVID and the 5Ks wearing a hand mask by some KOL were replicated and be utilized by many mass media channels around the world. So the effectiveness of the KOL not only limit to the Vietnam border, but can be expanded to US and other countries. And suddenly it's viral. It's viral. It's really by many mass media channels, and because of that, it brings back to Vietnam's and make people more familiar with the way how to prevent the COVID-19 outbreak in cleaning their hands in the correct way and something else. So KOL play a very important role to amplify the message from the governments. And again, besides that, also many of them they also collaborate quite well and keep working day by day to voluntarily support the governments by go now and encourage people to stay home, and that's why you can see they also joining together, have a lot of encouragement song, but not kind of very boring song like in the traditional way, but a very new modern way. They try sometimes they replicate. They use the very trendy music, very trendy song from the popular singer, and they try to paraphrase that in the language they use in the pandemic one. So that makes the song more interesting and more engaging and easy for people to remember. And besides that, you can see they're also very active and go out and correct people to stay home by serving them. For example, here we can see that all of the famous singer, they go into these hospital where people need to isolate and quarantine during COVID-19, and they try to sing something to encourage people to stay home and stay healthy. And then in order to examine further the role of KOL, I and my research teams also tried to conduct a study in the year 2020 to examine how the government campaigns running by the Ministry of Health of COVID-19 will generate among all of the citizens through the mediator of the role of KOL. So we try to examine the role of the KOL, but we don't really go much into the macro KOL, but we try to also study the role of the micro and nano KOL in order to deliver the message. And the finding also something very interesting that they also highlight that the role of micro KOL also amplify the message from the government. So the more people expose information from the government on internet, the more they will lie that, and they will take some certain action and form attitude. But social media exposure doesn't automatically communicate and transform the behavior. It needs to go through the sharing by the micro and nano KOL, who are have very close relationship with the citizen. So for example, you have a lot of connection with some of friends, some of colleagues, some of the prominent people that we have a lot of connections. And so we're hearing the macro KOL and singer something to say, but we don't take any action. But if those and share more by the relevant people who belong to our network, and we can have more tendency to believe. And so we also take onto the figure, and we can also see that these people, they have more impact by the internal, the nano and the micro KOL than the macro KOL. So macro KOL have to agree the awareness about the campaign. So when then the macro KOL, they do something on social media, people say, that's so good, that's very interesting. But to ask them to form the positive attitude or to take some certain actions, it's not in there. So in order to form the injunction norm, they can only utilize by seeing some of the mid, micro, and nano KOL, and from that, you can form attitude and the subsequent behaviors, which means for awareness, I think the macro KOL play some very important role, but to trigger action and trigger the common behaviors from the citizens. So it could be considered the role of the middle and nano KOL in this case. So you can see clearly the 5 figures have been so that the important role of the interpersonal communication from the nano and micro KOL sap the people attention and form their prevention behaviors, and that's why they also form attitude to stay home. So attitude doesn't mean that positive, negative. Sometimes they can see that people doing something that staying home and doing 5Ks, but they don't really like that. But again, whether they like or not, they also seemingly follow the practice, which means that they go and have successfully utilized both roles of the macro and micro KOL. So the study also amplify and highlight and also strengthen the other finding in the past that the role of the KOL have transformed likely from the macro KOL to the nano and micro KOL. Because of that reason, some people can have form more attitude to do some certain behavior and execute by the government. So traditional mass media work well in terms of creating the awareness, but to form certain attitude, government now try to utilize well the role of the nano and micro KOL in order to foster the behavior and strengthen the behavior of people. So that is some of the significant findings on that. And besides that, you can see the nano KOL and also play some certain role, also not only to share the good news, but sometimes to manipulate and share the very unreliable news. And that's why the government also take some certain action with that. So recently, I feel that the government they can control and they take a very good approach to utilize well the role of KOL to foster the behaviors of the people in Vietnam, and in particularly in the case of COVID-19 pandemic. You can see clearly the way how government they transform themselves. They don't really go in mass, but now they go more on mix and utilize well the role of KOL. And that's some key finding that I want to share to the entire teams. So in summary, I think it's very clear that the government have successfully utilized different communication platform. You can see they also utilize the own media channel, but also the hybrid channel for with the KOL, and also go to the nano one. But again, so further study I'm currently conducting, I try to study and compare between phase 1 and phase 2 of government communications. In phase 1 that last year, the government do quite well. But in phase 2, recently, you can see that in Vietnam, the government have some hiccup in terms of communication. So they don't have very clear communication message from the top to the bottom to the execution plan. And that's why they bring a lot of confusion. And that's why a part of that could be a reason why the pandemic is still, the outbreak is still there. But further study needs to be done before I can make the conclusion. So clearly the important role of KOL were amplified and evident clearly in the study. And that's what I want to highlight and contribute back to another study from Vân and Ramsey about the pandemic in Vietnam and how the government communication play a very important role to make the pandemic under control or to make the pandemic become out of control due to some certain reasons. All right, that's all for my presentation. Thanks for everyone's.
Thank you very much, Dr. Long Nguyen, for the interesting presentation about the roles of KOL in communicating the pandemic. We are a little bit behind the schedule, so I would like to wrap up here and then give back the floor to Nguyen for the next session, please.